Welcome to BoCo Summit, the Rural Broadband Technology Solutions Summit 2018. We wish to thank our sponsors for helping to create a path for fast, affordable connections. Our next BoCo Summit session is a panel discussion entitled Look to the Future, Real Applications for Wellbeing, with Amy White, who is a Dean of the STEM program at Virginia Western Community College, and Susan Goad, who is the Director of Social Services of Botetourt County. Meet Nicol Turner-Lee, Ph.D., Fellow at CTI with the Brookings Institution, and Brandon Evans, who is a Director at Friendship. This will be facilitated by Dr. Betty Adams, who is the Executive Director of the Southern Virginia Higher Education Center.
Joining me on the panel, along with Brandon, is Susan Goad, who is the Director of Botetourt Department of Social Services. Is Susan here? Oh, good. We also have Amy White, who is the Dean of the School of Science, Technology, Engineering, Mathematics at Virginia Western Community College.
You taught me in high
And then we're very happy to have Dr. Nicol Turner-Lee to join us. She is a fellow with the Brookings Institute and the Center for Technology Innovations.
Done well. You just turned into Yeah, that was with, oh, sorry.
We just had a revelation.
Yes.
I taught him. And when he was talking, I'm like, I know that. So sorry, apologize. Both of us scoot down. With flying colors, flying
Obviously, he did.
Robbery will get you places.
Okay, so the title of this panel is Look to the Future, Real Applications for Wellbeing. And we had a little taste of what Brandon talked about earlier. And what I'm going to do is ask each of the panelists to talk a little bit about who they are and what they do, but also answer this question: how does fast, affordable internet enhance or facilitate your ability to provide the programs and the services that you do in your job? And Nicol's question is going to be a little different because of her work, but we'll take care of that at the time. So I'm going to start with Susan.
Thank you for inviting me today. I feel a little out of my element because I'm not really a technological person, but obviously Department of Social Services is sort of serves a lot of folks in Botetourt that a lot of people don't know about. And so I will say that the state for some time has been trying to move forward the idea, the notion that people can apply for benefits without having to come into social service offices. And that's a huge benefit, especially in a rural community. In case you don't know it, Botetourt has a transportation problem. We don't have any public transportation here. So folks coming in to have to apply for benefits with a physical application, 14 pages long, is a challenge. For transportation, also for just the elderly and disabled folks, it's a challenge. So there's been a push for some time for that's one option, is that the ability for people to apply online is a huge benefit for the citizens that we serve. So that's one part of it, I would say. The other part, I would say, most people, if you don't know how social services are organized, but most agencies really consist of sort of half and half. So half the agency, half the people that work in social services do what we call benefits programs. So that's Medicaid, that's SNAP benefits, other programs, that's what they're responsible for doing. And the other half of the agency are what we call service workers. And service workers are the folks who do child protective services and adult protective services. And so between that divide, I have workers that are out in the field. And so broadband is having internet access, having the ability to call someone when there's an emergency. You don't know what you're going to encounter. There's a safety concern, obviously, with folks who are going out knocking on people's doors, especially if you're talking about a child protective services incident. You know, people maybe not welcome you so much when you're a social worker saying, I need to talk to you about your child. So there's a safety factor there. So the fact that people maybe not being able to have access to a cell phone to be able to call if there's a danger or there's a need, that's a challenge. I don't know if that's all you want me to say or not.
That's a good start.
Okay.
And now I'm going to ask Amy, tell us a little bit about what you do at Virginia Western and about how fast, affordable internet is helping you provide services and programs to your students.
Sure, thank you. It's a pleasure to be here. What I do at Virginia Western is administer our science programs, our engineering, our mathematics, and our information technology programs. I'm over all those, and it's a real pleasure to work in that world. I'm a geek too, as Brandon said, and we're proud to do that together. It's been my pleasure throughout most of my career to be in the classroom and teach great students like this. So that's been a real joy. Moving into administration, I get a bigger look at education, not just my particular discipline, and what high-speed, reliable, affordable, and I emphasize affordable for our students. What that does for us is it allows access from home. So you have kind of two aspects to think about there. You can think about folks that want to take online classes and do their education virtually. Without reliable internet, that is virtually an impossibility. We have students that try to do that at libraries or try to come on campus and use our facilities, which they're more than welcome to, but it kind of defeats the purpose of being able to mix your education, your classes with other parts of your life. So for online distance learning, you need it. But even in the classes I find that we teach face-to-face, it is really important for students to be able to go to a facility because so much learning is virtual and there's so many resources. And I think we're going to talk a little bit about equity in this conversation, but there are so many resources out there that we refer students to, that we give homework through. A lot of your textbooks now have online components, virtual components. A lot of the homework, almost all the homework in some classes is done through that. If a student doesn't have that access at their home, it's a real inconvenience. I know I try to work at home. I live in North Botetourt in Buchanan, and I try to work from home. And there were some times with a previous provider that I was simply unable to work, and I had to just throw in the towel and say, I'll do this tomorrow at the office. So it really does impede learning on many levels. Thank you.
And Amy, you wanted to share how the summit has already, impacted your students.
So, yeah, I did want to, I didn't know if that was in this question, but certainly I want to thank the commission because Michelle and Arlene came to me probably back in the summer, and we had a crazy idea to involve our students, and Walter has been with our students. We wanted to involve the students, so I contacted one of my instructors, and this was really fast and furious. We started class on the 20th, and on the 21st, Walter came to their class and Michelle and said, we have a project for you all. And we laid out the Botetourt program problem for them and gave them like 3 weeks to solve it. You're going to see their work. We have posters here tonight that are in the conference room, and we had the presentations judged. They had to do presentations. We had them judged, and the winning team will speak tomorrow. Both members are going to be here, and they're going to give their presentation. But for me, what was so valuable about that was we got to put a real-world problem in front of really first-year, freshman-level students. And they are so engaged now in this problem. And interestingly, Walter, I don't know if you remember, the first night you were there, at the first class, there was a gentleman who was very resistant. And he's like, this is so much work, and how am I ever going to look this up? And this is on top of everything else I have to do. He's the one that won. So it's really, really ironic. Great lessons there. But we are so thankful, and anytime we get a chance to put real life problems in front of our students, they learn from it, and we learn too, because they did have some really creative approaches to this problem. So thanks to everyone who let that happen.
That's great. Thank you, Amy.
Sure.
And Brandon, you've already kind of paved the way and talked about how technology is impacting healthcare. How does fast, affordable internet enhance or facilitate your ability to serve the retirement community and long-term care patients?
Yeah, well, I'll start off with the fast part. One of the things that I look at in terms of managing that care is how can we provide better services to the residents that we're hired to care for. And really the best way to do that is hire good people that are invested in their own personal growth, so that comes back to the affordable part. But every second that is spent due to a computer delay or charting or what have you is a second away from an interaction with someone who really deeply needs that personal interaction. And with the boom of course, dementia, Alzheimer's, there's a lot of residents that we're caring for that we have to lay eyes on at least every hour, if not sooner. And so every second that we miss from being able to do the jobs of caring for people because we're busy charting takes away from that. The affordable aspect comes to play with, healthcare is expensive. And so as an organization, if the technology that we need costs a lot, it's passed on to our consumer, and that takes it out of their range to care for it. From a managerial standpoint, as I mentioned earlier, we like to hire and employ those who are invested in their own personal growth because we know that they're going to be invested in caring for others. And if they don't have the means to do that in their residents, they aren't going to improve themselves, and they're not going to be able to know how to care for their residents better.
Right.
So,
Thank you.
you're welcome.
Dr. Nicol, you have written extensively about rural America and how broadband and media impact rural America. And so with this question, what I would like for you to speak to is how does having fast, affordable internet impact rural America, and build into that what you talk about in your article, Closing the Digital and Economic Divides in Rural America, Digital Exclusion.
Yeah, no, thank you. I'm so happy to be here. I'm just taking it all in like a sponge, actually. My name is Nicole, as it was mentioned, and just so you know, I'm a researcher. So I'm actually not engaged with programs. I used to be. I was with a group called One Economy Corporation, and we spent a lot of time actually wiring homes via Ethernet connections. The internet wasn't really the internet. I know I look young, but I'm not that young. I still tell my kids I remember that sound from AOL, the modem. They kind of look at me like, what was that? It's almost like when I ask them about the cassette player. They have no idea. But this is a really interesting topic to me. My research portfolio at Brookings Institution, which is a global think tank located in Washington, D.C., is really around this understanding of digital divide and how that actually is transforming itself to become a driver for more disconnectedness among Americans. And the article that we're referring to is I actually paid a visit to Stanton, Virginia. And when Arlene invited me out here, I said I was coming. So I drove all the way down from actually just Alexandria to visit with you all because I think this is such a pressing concern. And I'm happy to see an audience of people who continue to engage broadband, and I understand that you'll meet my dear friend Jim Baller tomorrow, who will be speaking to the group. There is a cost to being offline. Years ago, we used to talk about the fact that everything was migrating from inline to online, and now we have about 11 million, roughly about 13% of Americans that are still not connected to the internet, believe it or not. Even with the rise of smartphones, there's still people that have no, particularly seniors, people of color, foreign-born workers, that have no concept, people who are disabled, who have no concept of how the internet can actually help improve their life. And so part of my exploration into rural America is I'm writing a book on what I consider to be this digital invisibility that's actually creating and percolating itself across the country. The digital invisibility is real. As it's already been mentioned from my esteemed panelists and colleagues here, the cost of not being able to get real-time health care has not only a stress to the U.S. healthcare system, but it exacerbates things like chronic disease and other preventative diagnoses that actually could be monitored and well managed through telehealth and telemedicine. We have a project on that. It's real in terms of students. The homework gap continues to depress the number of students that are able to attain a college degree, let alone a high school degree or a general GED. It's real when it comes to social services, with everything migrating online, the impact to cities to not have people correctly and sufficiently connected to online services costs cities their ability to modernize their services. It costs consumers because guess what? More and more consumers are paying a surcharge to actually go into places and to process functions. So imagine if you are low income, you are rural, without transportation, and you're not well. you find yourself on what I call the other side of the digital divide. And that's why it matters. In my work, I look at everything from infrastructure development and deployment, what's the best way. I was listening to the fiber conversation, been following that very closely, to what types of services should we be moving online. And I personally experienced digital exclusion, and I'll sort of wrap it up my comments here. I recently took both of my kids out to Boy Scout and Girl Scout camp. One was in Goshen and one was in Mount Solon, Virginia. And being a person that pretty much lives within a well-connected, densely populated area, I could only rely upon the good old GPS. And every time I went through that dead zone, I had to go back 30 minutes to pick up a signal to figure out which way to turn. A 2-hour trip took 4.5 hours. It took a lot of encounters with cows. And for a young woman that grew up in New York, it took a lot of fear and intimidation to be worked out that day to ensure that I landed up in the right place. But I share that story, not only was it eye-opening for me, who sits in the beltway of DC trying to negotiate the right policies, what it did was it opened my eyes to the critical need for more investment in rural America. Right now, the FCC estimates that it will be about $40 billion to wire 98% of the country. I would say about 55% to 60% of what we know is the investment in rural America alone, starting with the access to telecom facilities all the way out to the programs that wrap around the infrastructure, the supply and demand. And so this cost of digital exclusion is high. As I heard someone mention in terms of electrification, we're talking about the new roadway that at one point you didn't have a paved road leading into many of your counties and cities, but now you do, and that roadway allows for this transportation system that connects people across national markets. The internet is now global. In my, and I'll just wrap up here, in my review of Stanton residents, I came up with 2 different stories, right? One was in Stanton, the Main Street America folks who lacked access to broadband felt that they were losing money and their ability to export out some of their services, to expand the visibility of Main Street Stanton. They just weren't able to do it, right? They were only confined to what they felt was, a main market of people that lived in the community, but they lost the opportunity to bring in new technology and innovation. It was funny, one of the places that I went to was trying to run a Square technology, which is the point of sale device. And he said, I want to use this new technology, but I have to make sure I have it in a particular position or else I'm not able to run the transaction. We should not be actually having our Main Street American small businesses go through that. I crossed the tracks of Stanton because they have a huge African-American population that came post-Reconstruction. And this one family that I met sitting in front of their house, who had been 3rd-generation Stanton residents, the young man said to me, I'm unemployed because this device where I can only find jobs, I can't afford it halfway through the month. So it's basically a box until my minutes re-up and my data plan provides me more information. Imagine this is the young man that still needs to be in contact with his 2 young kids with social services. He still needs, there's no more classified, right? And he lives on the other side of Main Street America. While people are doing innovative things, the barbershop guy that I met who has a Wi-Fi hotspot sitting in his little shop there, the young man that moved from DC to open up an organic restaurant that pulls the sources of farmers to actually create, this great vibe and resource, they all have the same issue, which is more access to rural America. And so I think as we have this conversation on the cost of digital exclusion, we're not just talking about can we put more broadband in so people can get an Uber. Be nice, right? But it's what does it cost in terms of well-being, quality of life, as well as entrepreneur and economic development opportunities if rural America is left behind. And that's sort of what I try to work on every day from a policy perspective and keep it honest. And I think coming here, it took me a long time, but I found it. And I was on the highway, so my GPS didn't go out. So I was able to get here, but I think all of your stories and experiences, I think, fit themselves into the mode of the narrative that needs to be told.
Thank you, Nicole. So our next question is about what are some of the technological advances that you see coming down the pike or are already here that are helping improve the well-being of your clients, your customers, your students. And Sue, I'll start with you. And I think you had mentioned that there's some state initiatives that are currently being piloted.
There are, aside from just being able to apply for benefits online, which is certainly a great advantage for folks who do have access and can register online for programs. The biggest expansion I've seen, or the focus the state has really changed, is on child welfare workers, giving them some tools much needed tools to help them be more efficient in their work. And really there's two things. Part of that is what we call a dictation service is a new initiative. So when you're out in the field and you go to a home visit with somebody and then you leave and you got to go 20 minutes away to another locality across the town, across the county, you can use your phone to call into a dictation service and you say, okay, I was at home visit Mr. Jones's house, this is what happened. They type up that contact for you and they email it to you. By the time you get back to your desk, you have that information and you just download it in the system. A great way to save time so you don't have to come back to the office and type all your notes. So that's one initiative. The other thing is what they haven't quite rolled out yet, but they're working on is it's going to be an app that they're going to have available for child welfare workers. And the benefit of the app is going to be similar in that you're going to be able to, as a worker, have access to forms on your smartphone. Maybe a safety plan if you're working with a family, you need a safety plan signed. It's available on your phone. You find your app, you find the form, you have them sign it. That's one way, or it could be forms such as you're placing a child into foster care. So now you're removing a child from the home and taking them to a different placement. There's a lot of paperwork that has to be done. All those forms are going to be available on an app, and that's one of the things that I think is really a positive focus for the child welfare workers. But it is about technology, but it's also about just seeing a different way to do work that's not been traditionally come back to the office and sit down and do it. There's people that are doing things in the field, and in a rural community, it's really helpful because you got to drive sometimes, an hour to get to one side of the county from the other. And so to save time, not only it helps you be more efficient in your work, but also hopefully the idea is that you're then able to spend more quality time engaging with families as opposed to doing paperwork and sitting behind a computer. And that's, we're in the people business. So connecting with clients is a very important part of what we do. And you're doing less and less of that if you're spending more and more time doing, typing and sitting in the office. And so those are two things that the state is rolling out now, and I'm really looking forward to how they're going to work. Yeah. Uh-huh.
Okay. Amy, how about for your students at Virginia Western?
So some technologies that are, I think, improving their life. Obviously, we use a lot of educational technology. Some of the textbooks, as I mentioned, have wonderful virtual components to them. That helps them. Some other rather specific examples of ways that we're employing technology to help them communicate, which I think is at the root of good education. But a little program called Slack. I don't know if anybody's familiar with that, but it is a wonderful tool to communicate. It's a group. You can have your students all into one group in one class, and it's like their private email, and it's like this ongoing dialogue. They ask questions. I don't understand this concept. Oh, I do. Let me help you with that. So that has really improved communication. Another thing that we're using now is Twitch. We're streaming a lot of we have a Fab Lab in our mechatronics program, and we stream a lot of our 3D printing to the Science Museum because the Science Museum doesn't currently have a working 3D printer. We have it at our shop now. We're fixing it, we hope, for them. But we're collaborating a lot with the Science Museum so we can stream our 3D printer and they can understand what's happening. They can watch it. They can talk to the Science Museum personnel about it when it's not even there. So it's really engaging them in the world of 3D printing, which brings me to my next big technology that's helping lives of students is our 3D printers. We have a number of them in our engineering technology and our engineering departments, and they are making things. We have robotics competitions because I think robotics is going to become, and you talk about allowing people to spend more time with people. If we can automate some of the processes that take us away from our actual human-to-human contact. People are kind of scared of robotics sometimes, and it's going to take jobs. No, I think it's going to make the people more available to do what people are best at doing, and that's interacting with other people. So we have a large robotics program. The students 3D print their parts for their robots. So not only do they learn how to program the robots, but they learn how to make them. That's been incredibly valuable. other technology, if we want to stretch a little bit, and this might get a little bit into Brandon's area, but our biotechnology program and our upper level science classes, we do a lot of DNA work. And we have our students manipulating genes. We have them going up to a computer and analyzing a 1 microliter of fluid to tell you how much DNA is in there. Wow. They are actually doing some really incredibly advanced technologies, and these are freshman and sophomore level students. So technology definitely impacts everything that we do. Obviously, in our information technology programs, that's the root of what we do there. But I will close my part of this with a thought. When we're dealing with students, we tell them that the younger students should prepare for jobs that don't exist yet.
That's right.
And I think the same is true with this. We should prepare for technology that doesn't exist yet. We don't know what the next generation is. These phones that we all carry have more computing power than the first computer I ever touched. And now I'm carrying around in my pocket, which is just astounding. So I think we really do need to think in terms of not what is, but what will be.
Thank you. Brandon?
I alluded to some of that during my
Yeah, you
presentation. But to go off Amy's point, currently with DNA testing, it's become a huge part of the industry to test to see what medications match your DNA, which is something that wasn't around several years ago. We now know that certain medications won't work with certain folks. There's a reach, as you said, with some things. The United States isn't the only country that's hit the baby boomer generation. Japan has. They're a little bit further along. They are doing testing as we speak about having robots interact with folks with dementia to where that they feel like they have a human presence. I know that sounds kind of creepy, but it's happening. But as of today, we are currently utilizing components to help notify us when a resident has a fall. There's nobody around, but it would detect a fall. We also have some that are dispensing medications for residents and calling to remind them of what time that's happening. And then one that's very practical, it's been around forever, is we're Skyping with our residents a lot because they recognize their family members and they're a little bit more calm and apt to listen to them. Right. So the technology for healthcare is endless, but these are just a few practical things that are working right now.
Mm-hmm. Yeah. Thank you. Dr. Nicol?
Yeah, let me, and again, I haven't been in a practitioner role in some time, but I follow all of you. I want to pick up on Brendan, like the aging in place stuff and technology is very, very critical right now. Years ago, Microsoft used to have demos in terms of pill size, et cetera, and now through Skype and future holograms of and images of people. I mean, how many people in here grew up on Star Trek? The ship has come, right? It's here, right? I think we're going to see more of that. And I did a research project not too long ago where the populations in the older generations that we need to be most concerned about are really the 75 and up, 80 and up. They are the least adopters of technology, but the highest in terms of medical need, right? And so we're going to see a lot more transition to teleservices, particularly as those of us, and it ties in with families, right? Families become more dispersed, aging in place is preferable. All of these technologies, I think, are going to drive right to older Americans. But I would just like to categorize, I think from what I heard, some other innovations that you all may be familiar with. I mean, clearly the Internet of Things, the sensor ecology is booming. It used to be Fitbits, just kind of putting it in the context of rural Virginia. Sensors in cattle are actually, I was in Lincoln, Nebraska, where they're actually doing some precision agriculture and precision cattling, where they're actually wiring farms to be able to look at the extent to which, animals, when they're breeding, when they're not breeding. They're using precision agriculture to test out water levels. So put that in your vocabulary with precision agriculture. This all requires broadband. I'll share an anecdote that was shared by a member of the Farm Bureau in Nebraska that said, we could do all these things, Nicole. We can buy $1 million John Deere tractor that has broadband capability, but if we have no broadband, it's just still $1 million tractor. It's basically how he put it, but he's telling the truth, right? All these things we're actually not going to be able to manifest, but the IoT market is going to continue to grow, even with precision medicine being, the latency that's actually coming out of new technology innovation is going to allow for remote-to-remote care. 10 years ago, I saw this actually done in Anchorage, Alaska, where they were actually providing specialty services, because it's primary care usually most people can get. It's specialty services, particularly in rural America, that you've got to figure out transportation for dermatological, cancer services, et cetera. But what we're going to see in terms of applications is much more preciseness when it comes to emerging technologies. Clearly, in the app space, we're going to see more apps that are actually creating more efficiencies. As more people, there was a study that just came out that 90% of Americans do carry mobile computing power. Of course, there's a disconnect if we don't have it in our communities, but people will be relying upon apps that get downloaded. I can't tell you how many times me as an individual who is technology proficient just screams every time I have to download an app for my child's school, for my doctor. But the app economy is driving the new gig economy, and that's something that we need to pay attention to. Social media is actually transforming itself to play a role in those private transactions of our life. These closed Facebook communities, as much as we care about our privacy, people are still using these social media apps to connect people in certain communities for care. I've seen more, went from Meetup to now groups on Facebook, for example, that are actually providing support for education, for services, and other. And then I'm going to scare you with this last one, which I actually study a lot, which are artificial intelligence and automation. The new emerging technology of robots, they have arrived, they have come. Amazon hired 55,000 robots for their Seattle warehouse to actually do some of the functions that we as humans do. And I want to respond to somebody else who mentioned about, I think you mentioned right about automation replacing humans. I want to tell you, I don't think that's going to happen. Somebody, Nordstrom's can be, ladies, this is for us, right? Can be as virtual as they want, but somebody still has to make the dress, okay? It's not just going to appear. But what it means is our colleges will have to retrain workers on how to do different assignments. Even for those of you with who have constituents or work on farms, even if the cow has a sensor or the water is monitored, somebody has to actually do the R&D. The project that I was looking at in Lincoln, Nebraska, where they were wiring up one of the largest cattle farms, the owner was doing it not just to have the technology, but he wanted to bring in students. And what's the best way to bring in R&D support is you have a wired community where they can actually participate. And I thought that was ingenious. I had never heard that before, and I think that's some of the uses that we're actually going to see going forward, much more of an applied context that's pragmatic to the changing digital and innovation economy in which we live in.
Thank you. And as much as I would like to continue asking questions, our time has expired. So please help me thank our panel. Great job. Great job.
Now we want to hear from you. Email us, bocosummit@botetontva.gov. Engage with us on our journey. We give a special thanks to our community volunteers, and special thanks goes to these organizations. Again, thank you, our sponsors, for helping us to create a path for fast, affordable connections. BoCo Summit, the Rural Broadband Technology Solutions Summit, is presented by Botetourt County of Virginia.